Hi everyone, it's me again, Nurse Clari, and in this video we will talk about multiple sclerosis. This is an autoimmune disease of the nervous system. In my previous videos under nervous system, I was able to discuss about simple anatomy and physiology and neuro assessment in the nervous system injury, head injury, spinal cord injury, and then abnormal electrical discharge of neurons in the brain, which is about epilepsy and seizures. And right now we will talk about autoimmune diseases, and we will start with multiple sclerosis. But before discussing multiple sclerosis, let's define first autoimmune disease. So what is autoimmune disease? Autoimmune disease is a condition in which your immune system mistakenly attacks your body. So there could be excessive production of antibodies. So this happens when the body's natural defense system can tell the difference between your own cells and foreign cells, causing the body to mistakenly attack normal cells. So there are more than 80 types of autoimmune diseases that affect a wide range of body parts. However, for the nervous system, we will just talk about the three main diseases. For most of the autoimmune diseases are rare. So let's now define multiple sclerosis. So in MS, the immune system attacks or produces antibodies directed to damage the protective sheet or myelin sheet that covers nerve fibers and causes communication problems in the central nervous system or between the brain and the rest of the body. So the CNS is made up of the brain and spinal cord and optic nerves. So this potential disabling disease of the brain and spinal cord can cause permanent damage or deterioration of the nerves. So let's now discuss simple pathophysiology of multiple sclerosis. So let's start, of course, with the CNS or the central nervous system. The central nervous system is composed of brain and the spinal cord. And this brain and spinal cord has nerve cells or neurons which transmit information between neurons. And these neurons are coated with myelin sheet to increase conductivity of impulse. So the myelin sheet function is to increase the conductivity of impulse or increase the transmission of the information. In MS, the problem here is that the immune system causes inflammation that damages myelin. So there is nerve demyelination, which is slowing of impulse. So there is a decreased nerve signal transmission because when myelin or nerve fibers are damaged or destroyed in MS, messages within the CNS or the central nervous system are altered or stopped completely, slowing of transmission of information. So there is a decreased nerve signal transmission. So what are the causes of this? Causes is actually unknown, but there are risk factors for this, like age. So in MS can occur at any age, but onset usually occurs around 20 and 40 years of age. However, younger and older people can be affected. Next is sex. Women are more than 2 to 3 times as likely as men are to have relapsing-remitting multiple sclerosis. Next is family history. If one of your parents or siblings has had multiple sclerosis, you are at higher risk of developing the disease. Next is certain infections. A variety of viruses have been linked to multiple sclerosis, including Epstein-Barr, the virus that causes infectious mononucleosis, and then Another risk factor is race. White people, particularly those of Northern European descent, are at highest risk of developing multiple sclerosis. People of Asian, African, or Native American descent have the lowest risk. Next is climate. MS or multiple sclerosis is far more common in countries with temperate climates, including Canada, the northern United States, New Zealand, southeastern Australia, and Europe. Next is vitamin D. Having low levels of vitamin D and low exposure to sunlight is associated with a greater risk of multiple sclerosis. Next is certain autoimmune diseases. You have a slightly higher risk of developing multiple sclerosis if you have other autoimmune disorders such as thyroid disease, pernicious anemia, psoriasis, type 1 diabetes, or inflammatory bowel disease. Lastly is smoking. Smokers who experience an initial event of symptoms that may signal multiple sclerosis are more likely than non-smokers to develop a second event that confirms relapsing-remitting multiple sclerosis. Now let's move on with the signs and symptoms. With the multiple sclerosis, the signs and symptoms vary. So it is different for every patient. So the damage to areas of the central nervous system in multiple sclerosis may produce a variety of neurological symptoms that will vary among people with MS in type and severity. So the damaged areas develop scar tissue, which gives the disease its name, multiple areas of scarring or multiple sclerosis. So symptoms often affect movement, such as numbness or weakness in one or more limbs that typically occurs on one side of your body at a time, or your legs and trunk. Electric shock sensations that occur with certain neck movements, especially bending the neck forward, or what we call Lhermitte sign. Tremor, lack of coordination, or unsteady gait. Vision problems are also common, including partial or complete loss of vision, usually in one eye at a time, often with pain during eye movement. Prolonged double vision, blurry vision. Multiple sclerosis symptoms may also include slurred speech, fatigue, dizziness, tingling or pain in parts of your body, and problems with sexual, bowel, and bladder function. So the signs and symptoms that I have discussed may or may not be present for each patient because it will always depend on the types or the severity of the multiple sclerosis. Remember, our brain and the spinal cord has its own function. Each part of the brain and each part of the spinal cord, they have their own different function. So whichever is affected, then that will be the signs and symptoms. So let's now move on with the types of multiple sclerosis. There are 4 types of multiple sclerosis: clinically isolated syndrome, relapsing-remitting multiple sclerosis, secondary progressive multiple sclerosis, and primary progressive multiple sclerosis. Let's start with the clinically isolated syndrome. So this is actually the earliest form of multiple sclerosis. So it refers to a single episode of neurological symptoms suggestive of multiple sclerosis. Often, on investigation using MRI, the doctor finds evidence of another abnormality in the brain or spinal cord. Having multiple attacks of symptoms defines relapsing-remitting multiple sclerosis. This is actually the most common disease course at the time of the diagnosis. So, relapsing-remitting multiple sclerosis is characterized by unpredictable but clearly defined relapses, also known as attacks, exacerbations, or flare-ups. during which new symptoms appear or existing ones get worse. In the period between relapses, recovery is complete, or nearly complete, or to prelapse function, or what we call remission. So most people with relapsing-remitting will eventually transition to a phase of the disease called secondary progressive multiple sclerosis. So this phase of the disease has progressive worsening and fewer relapses, though sometimes there are occasionally relapses and minor remissions and plateaus. So next is the primary progressive multiple sclerosis, or PPMS. This is characterized by a slow accumulation of disability without defined relapses. It may stabilize for periods of time and even offer minor temporary improvement, but overall there are no periods of remission. So approximately 12% of people diagnosed with multiple sclerosis have PPMS. About 5% of people diagnosed with PPMS experience occasional relapses with steadily worsening disease from the beginning. Now let's move on with the diagnostic tests. There are actually no specific tests for multiple sclerosis. Instead, a diagnosis of multiple sclerosis often relies on ruling out other conditions that might produce similar signs and symptoms, known as a differential diagnosis. Because, as we have discussed earlier, there are different signs and symptoms for multiple sclerosis depending on the affected area of the CNS. So diagnosing of multiple sclerosis really takes time. The neurologist has to assess several things because there is not one test that can diagnose it. So assessing the patient's symptoms may need to rule out other diseases. So first diagnostic test is MRI. This is to assess for lesions in the brain and the spinal cord. Next is the lumbar puncture, which is to assess spinal fluid for specific proteins, which is called oligoclonal bands, which are immunoglobulins. Because if these are present, there is inflammation in the central nervous system. Next is evoke potential studies. Sends electrical signals to the central nervous system, and then we will see the response of the patient. So this is the usual test for usual diagnostic test for the multiple sclerosis: MRI, lumbar puncture, and evoke potential studies. Next, we'll discuss about the treatment of multiple sclerosis. So there is currently no cure for multiple sclerosis. The goal of treatment is to help the patient cope with and relieve symptoms, slow the progress of the disease, and maintain a good quality of life. And this can be done through a combination of medicine, physical, occupational, and speech therapy. So the treatment is more on supportive and in accordance to the signs and symptoms presented. Next is, of course, give immunosuppressant and plasmapheresis. Plasmapheresis is a method of removing blood plasma from the body by withdrawing blood, separating it into plasma and cells, and transfusing the cells back into the bloodstream. It is performed especially to remove antibodies in treating autoimmune conditions. Because remember, as I discussed earlier, in autoimmune disease, there could be an excessive production of antibodies, and it mistakenly attacks your body. Alright, thank you so much for watching this video. On my next video, I'll be discussing about Guillain-Barré syndrome. It is also an autoimmune disease under the nervous system.